Okay, guys, we're going to start on this would be review 4, community and critical care. Community, we're going to start with leadership, supervision, safety. One thing would be nutrition. You'd want to assess eating habits. Does the patient have teeth? How is their swallowing? Do they have difficulties with that? If they had difficulties with swallowing, who would we refer to or try to get a consult for? Who prepares the food? Who purchases the food in the home? What is readily available? Sometimes we need to look at someone's finances. That will depend on, how much did they spend on their um, daily living things as far as their electric, their phone, their water, their TV, things of that nature. And then how much do they spend on their medications a month? And then what's left over sometimes is what goes towards their food. You and I both know that foods that are processed a lot of times are less expensive than the things that are more natural and the things that are probably healthier and better for us. But you can't be judgmental about it because sometimes it's just a matter of what can they afford. Can they fix the food themselves? Can they get the can lids open? Now we have the little flaps underneath where you can pull it up and go off, and you don't have to physically use a can opener. For people that have arthritis really bad in their hands, a can opener is something that's hard for them to use, a manual one. They can use an electric can opener, and sometimes it'll be okay. But even then, depending on how heavily the can is, they may need some assistance with that. Can they go to the senior center and get their a meal? How about the food pantry? Are they able to get there? If they can't drive, maybe they can't get to the food pantry or the senior center. But what about Meals on Wheels? Can they get that type of thing in their area? We do not all live in a metropolitan area, so sometimes those resources are not available to us, but it is available in some. Basic nursing skills, feeding. Think about if if the patient's had a stroke, if the patient's blind, what adjustments have to be made in order for that patient to be able to get the nutrition that they need. What adjustments are we going to make for this patient to ensure that they get what they need? For a child, what are some adjustments you make in diet? If it's a young child, sometimes finger foods, because that's what they want. They're on the go. But then again, you have to make sure that it's stuff that they won't choke. Even on the go. Variety of ages. We're going to look from the young to the old. Think about safety, nutrition, and basic nursing skills that are involved in all of that. And if you had to delegate or you had to, give a task to someone else, again, think about the scope and what kind of task need delegated. Is that person competent to be able to do it? Next, we have telephone triage. What information do you need to proceed to, depending on what the situation is? If they're calling in to triage and, they're asking questions about whether they need to come be seen. If it's something that they're calling in and it's an arrest patient or they found someone unresponsive. Sometimes there's a lot of different things that you're going to ask, but you would want to know what is the situation, who's calling, who is present, what happened before, and if a patient, if they fell down and they were found unresponsive, do you know how long they've been down? What is the patient's allergies? Do you know their medications that they take or have taken today? Did something happen before they went down? Was this a witnessed event or was it not? What's their medical history? Do they have some previous diagnosis that we need to be aware of? Are they safe? Can someone get to you? If we call if the ambulance is able to come, what are the directions to get there? If they do get there, is the door locked? Is there gonna be someone who can open the door for them? We also need who all's in the home? Do the police need to be called too? Not just the ambulance, but the police. If you're calling to check on a patient after admission, how are things going? How, has the patient been taking their medications? Are they keeping up with the things that they're supposed to? If they were supposed to do finger stick blood sugars, dressing changes, are they doing that? If they have home health to come in to check on them, has that been happening? Do they have any support? When's their next follow-up appointment? There's a lot of things that you need to think about. And then when you think about triaging too, think about triaging in disasters. I think we've talked about this before. If you didn't go back and look at that, you probably should. Triaging disasters is a little bit different. We don't try to fix everybody. We fix the ones that we can fix. And we leave a lot lay at the wayside there, but that might be something that you need to go check on too. Assignment to a PN, which is a practical nurse. Again, what's the scope of this person's practice? For a practical nurse, like a licensed practical nurse, what is their scope of practice? What are they allowed to do? It depends on the situation. Sometimes it depends on the facility. And it depends on state to state. So you need to know those things. Depending on, your board of nursing, who's responsible for this person? Who's responsible for the licensed practical nurse? Also need to know what task are they comfortable performing, or is there some documentation that that they are competent in this task, that they've done it before, they've been checked off. This is something that they can go do on their own without someone looking over their shoulder. Those are some things that you would have to think about before you assign certain tasks to them. If a staff member's all the time saying, no, they don't feel comfortable, sometimes they're just trying to get out of something too. But again, unless you can say that, you have to be careful, because again, who is responsible for this person? You are, as a registered nurse. So HIPAA is another one that we need to talk about. The Ebola virus. If you have a case of the Ebola virus, I think about too, like right now, the COVID-19. What is our responsibility to the patient, to your staff, and the community at large? Obviously, it needs to be reported. It needs to be reported to the CDC and to the health departments, which your community health department usually does report it to the CDC, and steps will be followed as deemed appropriate for that person. All cases are reportable, but there's not a name or an age that's usually attached, at least not in the community information that is given. It is given to the reportable site. As far as the health department, those would probably be questions they would ask. Also, they would probably ask for the CDC for their numbers to be accurate too. If there was a case reported in the community, I think there would probably be more information regarding prevention and preventing the spread. If they knew that something was coming down the pike and it could be an essential problem, we knew that the COVID-19 was all around us, so people have been taking precautions. People have been doing things that normally they wouldn't maybe do, but there's all kinds of information out there to prevent the spread, prevent this from, prevent yourself, help yourself, prevent others. But if you actually had a case, I think they would probably put even more information out there to make people aware of what is going on in your community and how are we going to treat it, how are we going to fix it, how are we going to address this issue. Standard precautions are going to be on all people we come in contact with, you know that. And if you can't wash your hands at a place, what can we do? We use soap and water, is the best. But if you can't use soap and water, then hand sanitizer will suffice. If you're at an area where you can use gloves and you have those readily available, fine. They're not going to be at every site. They're not going to be at every place that you go. And again, then you would want to monitor signs and symptoms of the virus. We would probably be paying attention to things on your community news, however that's reported, as far as if it's reported on the radio or on a Facebook page or something like that. You would need to know, what are the signs and symptoms that I need to be looking for. And again, your health departments will be the ones that will be putting out information for that. Another thing that we have to talk about is legal teaching nursing process risk management infection. We do standard precautions on every patient that we come in contact with. If you don't, you should. We're going to assess and monitor vital signs. We're going to check fever. If there's a site of entry, we're going to make sure that we keep looking at that site to make sure that there's no breakdown in the skin, or it hasn't broken down worse than it was. Assess and monitor O2 sats, shortness of breath, vital signs. How does the patient look? How does the patient feel? When does the patient need to be alert about certain things, as far as when do they need to tell me that something's going on? As soon as possible. Sometimes we don't want to have a full-blown attack of something if we can keep it at bay and we can keep it from getting to that point. It's like with pain. We want to keep pain at bay. Once pain gets so unbearable, it's really hard to address it. It's really hard to fix it. It's going to take more than what sometimes we have readily available right at that moment. We're going to have to call and address the situation with the doctor. So we want to try to keep things at bay at most possible, if possible. Are they having pain? And if they are, on a pain scale, what scale do you use for children or delayed patients versus people that have no delays? Was antibiotics ordered, and were they given correctly? And again, usually you wait and get a culture of whatever the site, if at all possible. Then you start your antibiotic. Was that procedure done? Was it not? If there was a wound, what's the color? What's the amount? The odor of drainage? And again, you may need a wound culture. That lets us know that we are addressing the bugs that is causing this infection, and we're going to hit it with the best possible medications that we can. Whatever it's sensitive to, that's what we're going to hit them with. Next, we have hospice home care delegation. What tasks can be delegated? Remember, what does hospice mean? There's a chain of command. Who's with the patient all the time? With the caregiver? There will be aides, but no one will be with this patient 24 hours a day except the caregiver. An aide will be in to do their job, then they go on to the next patient. They have assignments. The caregivers, again, is going to be the one that's going to be taking care of a lot of things with this patient. Is this your ideal situation? Probably not, but this person's going to be responsible for a lot of things. They may be the person that's given their family member their medications, because the nurse isn't always there either. That's not how hospice home care is set up. Hospice home care is set up that they will stay in the home no matter what's going on. You'd want to make sure there was a DNR ordered, and everyone was aware of it. Home care is very different. You're going to delegate care to all staff, but again, what tasks can be delegated to the LPN, the RN, the aide, or even the caregiver? The caregiver becomes an aide slash LPN or slash RN at times, because sometimes there is no one else available. They can call, and there's nurses that are on call and all of that, but sometimes they have to be that person. They have to be the eyes and the ears to be able to report things. So we want to make sure that they know how things work. Next is geriatrics. We have fall risk criteria. What makes them a fall risk? Obviously their age. Are they taking multiple medications that may cloud their judgment? Or even if they're not taking multiples, have they been started on a new medication that may precipitate that? If so, that may be a criteria. Multiple diagnosis. Have they had multiple falls in the past? Do they have trouble with their bowel and their bladder. Who do they live with? Are they alone? Are they with family? Do they need assistance, walker, cane, persons? And with that, if they are a fall risk, then what are things that we need to put in place to prevent falls? We've been over this before. And then with that, go a little further and think, what tasks can I delegate? What tasks do I need to make sure as the nurse that I am doing? Those are some things that you do need to pay attention to. Next, we're going to move on from community to critical care, SBAR. What is SBAR? And it's for post-op abdominal pain relief. SBAR, situation, background, think about those things. So for post-op abdominal pain relief, we're going to think about what kind of surgery did they have? When did they have it? How soon was it? What kind of medications have they already had? Allergies, what are they allergic to? Is this something that can be given PO or IV? How is it, going to be administered? Medication, your pain scale. We also want to think about with abdominal pain relief, you might want to change their position. We're going to make them cough, turn, and deep breathe. And why are we going to do that? We're going to make them use an incentive spirometry. Why are we going to do that? What are we trying to prevent? With that, how can we do that to make that easier for the patient no matter what they've been going on? Also with the relief, we might want to turn the lights down. We might need to turn the TV off. We might need to keep things quiet. We also may need to just reevaluate what's going on with the patient. Maybe something else is going on. And what they've been given or what we've been doing is not working. So we're going to have to go back and reevaluate and plan and implement something different. There's another question that was talking about SBAR and post-op bowel. When we think about post-op bowel surgery, I think about a focused assessment. What am I going to be focused on? What will happen after surgery? What am I going to hear in the abdomen and the bowel sounds? Am I going to hear any or am I not? They're probably going to be what? Are they going to allowed to have food? They're going to be NPO at first. Then they're going to start clear liquids and regular food. We're going to make sure that they have bowel sounds before we can do any of that. What happens to when someone has bowel surgery? It takes a while for stuff to come back. Think about if we're giving pain medicine on top of that. Is that going to delay things or is it going to speed it up? What's going to happen? Also think about, we'll want them to have a bowel movement after they have bowel surgery. If it's someone who's had a lot of pain medications, what are some other things that we are probably going to have to expect to have ordered in order for these things to happen for this patient? Got to think outside the box. We'll need to monitor eyes and nose, especially the bowels. And again, document, and assess. We have a couple more questions here. End-of-life ethics review. End of life is very important, and you'll talk about that even after you get out of school. You'll have to do an end-of-life continuing education. For an ethics review, we would want to know what are our orders? What orders have been, what is ordered for this patient? Do they have a DNR or do they not? If no orders, you may need to have an ethical review. What are the results based on what? We're going to talk about end-of-life care. End-of-life care is pain management. We want to make them comfortable. We want to do everything that we can possibly for them as far as nutrition, skin assessment, things like that. But ethics come into play when there's a question about things. If a person had a DNR order, but then they also had a medical power of attorney, does that medical power of attorney have the right to go above the DNR order? There's a lot of things that come into play with that, and your situation is going to be very different, but there's ethical reviews that's their job. And if you are on that panel, because lots of times it is a multidisciplinary review board, and there's a lot of information that goes with that. Alrighty, we have SVT management is a question we need to talk about. What is SVT? How do patients present? What would our plan of care be? What would be some questions we would need to ask this patient? Has this ever happened to you before? What were you doing when it happened? What did you do after you noticed that this was going on? Did you stop what you were doing? Did you rest, or did you just continue with what you were doing? What kind of things do we expect to happen when someone comes in and they are in SVT? What orders would you expect? What medications would you expect to be given? What instructions would you teach the patient for the moment and then for discharge at a later date? What do you need to remember for the next time for this patient? Lots of times if they come in SVT, it won't be their first time. Eventually it'll probably happen again, but not always necessarily. There are certain things that we do to try to correct it. So think about all of that. That's some of your life-saving measures that we talk about, your ACLS stuff that, and remember, you'd need them to be on telemetry. You definitely need to check vital signs. And if you remember about SVT, it stops the heart because we want to see if it's going to start back up in the right rhythm. And you need to let your patients know that, and it doesn't feel good. Last question for this section, safety, meningitis, increased ICP. What would we need to do to prevent this? How do we get meningitis? Are there things to protect us against meningitis? We would need to do standard precautions. What will you see when you see increased ICP? I know Elise has talked a lot about that. What do you look for? What are the first things that you see? What are some late signs that you see? What do we do to prevent this from happening? What will you do to prevent it from happening again? What makes increased intracranial pressure happen? It doesn't have to be meningitis. There can be trauma, can be other things that can also make this happen too. What medications will be given? What are some nursing things that I'm going to expect to be done? IVs, vital signs, we're going to have the room quiet. Who's going to get meningitis? What population? Those are some things to think about. That's all for this section. It was community and critical care. I'll be putting up another one, and I'll be putting another one to Blackboard when I get it done. And it'll be on some of the other issues. We have a lot of professional issues, which is very important that we go over them. I hope that this has been helpful for you, and I hope that you are utilizing it as it's supposed to be. I also hope that you are doing your practice questions, because those are for you and can only make you better. Also, I'm going to put up on Blackboard an announcement that this is available. Also, that there is some job opportunities. They're starting, employers are starting to call about graduates. If anyone is interested in nursing home down at like the Fort Ashby, Dawnview, that area, I've talked with their person quite a few times. I think you'll be very happy with the salary, and she's very interested in talking with any of you students that are interested in coming there. She gave me her numbers, and if you are interested, please contact me and I'll get that to you, and you can set up a time to call her. And she can answer some of the questions that you may have. Otherwise, I hope everyone's doing well, and I hope you're getting your work done. If nothing else, I'll see you next Thursday, guys, for the CAT HESI. And I'll be sending out information next week regarding that. I think we'll probably meet at 8:30. That way we're not here so late. And we'll start the exam when people get here, okay? I'll be sending out an email on that, so or a Blackboard message, so please be paying attention so that you can get all that information down. Thanks, guys.